This is Angela Presson, and I'll be talking about why most research results are false. At the end of this talk, you should be able to articulate common practices in clinical research that lead to flawed results and articulate alternative good research practices. In the past 10 to 15 years, there's been several articles describing why research findings are false. And here's an excerpt from one of them. Any claim coming from an observational study is most likely to be wrong. Coffee causes pancreatic cancer. Type A personality causes heart attacks. Trans fat is a killer. Women who eat breakfast cereal give birth to more boys. All these claims come from observational studies, yet when the studies are carefully examined, the claimed links appear to be incorrect. What is going wrong? As a reminder, this is the study design level of evidence pyramid, and observational studies, which are 9 out of 10 medical studies, compose most of this pyramid. We have cohort studies, case control, cross-sectional studies, case series, case reports, and experimental studies are far less common, and randomized controlled clinical trials are, or RCTs, close to the top of the pyramid, are considered like one of the best study designs. At the top we have systematic review and meta-analysis, but while that previous quote was describing how a lot of the false findings are from observational studies, which is in fact the case, it is possible that poor research practices can happen in randomized controlled trials as well. So it's not just observational studies that are at fault here. Okay, so what are some of the most problematic research practices that are leading to these flawed results? We have inadequate focus of research question in the data analysis strategy. This includes multiple comparisons and multiple modeling methods. We have inadequate power due to small sample sizes or small effect sizes, and reporting problems, selective reporting, or not providing enough information to reproduce results. On the following slides, I'll be talking about each of these in more detail and also some solutions for improving research quality. So first, let's talk about inadequate focus of the research question, multiple comparisons. This is a cartoon from one of the articles that I mentioned, published fairly recently, and in this cartoon they're trying to compare the color of jelly beans eaten to acne. So they start with purple jelly beans, P is greater than 0.05, brown jelly beans, P greater than 0.05, and it continues until they get to green jelly beans, and they find that the P is less than 0.05, and the follow-up news article headline is "Green Jelly Beans Linked to Acne with 95% confidence." So that's an example of the multiple comparisons problem. Basically, the more things you test, the more likely you are to find a positive result just by chance. So it is really helpful to focus your research questions. Another example of something you see in the medical literature is defining outcomes or exposure variables multiple ways. And again, that just kind of facilitates the multiple comparisons issue. For example, blood pressure could be analyzed as a continuous variable, and then it might be analyzed again as a dichotomized variable. And if you imagine that this variable is compared to 10 other variables, then you're now doing 20 comparisons instead of 10. So the solution here is to focus your research question. And I talk a little bit about how you can do that in a follow-up talk on the statistical analysis plan. And aside from that, if you must run a lot of comparisons, you could potentially handle it by adjusting the p-value or obtaining a validation data set. Okay, so multiple modeling methods are another example of an inadequate focus of the research question. This is a little bit more of a gray area, but often researchers are interested in using model selection techniques that will select a best set of variables from a larger set of variables in terms of their association with the outcome of interest. And the problem with this approach is that a lot of tests are done in the background, and you actually aren't even aware of how many tests are conducted, and the resulting confidence intervals and p-values of the predictors in your model are no longer valid because they're not adjusted for those multiple comparisons. So the solution here depends a little bit on kind of what your research goal is. A lot of times it's an explanatory model where you just want to know what are the independent predictors of your outcome of interest. And in that case, I would recommend potentially including all variables of interest in the model. This, of course, depends on whether the sample size could support that. But this type of approach would be superior to selecting a best subset of predictors. So that's kind of one possible solution. And if the goal is a prediction model, then you might use cross-validation or a validation data set. So a prediction model is sort of is like a model where you would imagine that you could get another similar data set and you want to predict the outcome of the patients in that data set. And the primary goal is just having a model that's highly predictive of the outcome. Okay, so the next problematic research practice is inadequate power. This comes about from small sample sizes or small effect sizes and not having the sample size to support your small effect size. The effect size is the magnitude of the effect difference between groups that you'd want to detect. And the solution here is fairly simple. You could just perform a sample size or power calculation before starting the study, and then you should act on this power calculation. If the proposed study is not feasible, then don't do it. You could modify the research question or possibly choose a different outcome that might give you more power, or if you really want that outcome, you could consider conducting a multi-center study. Okay, so the third problematic research practice is reporting problems and selective reporting. So selective reporting is reporting only positive findings and failing to report on all the tests run, and that would make the findings appear more impressive than they actually are. So back to the jelly bean example, we saw that they conducted a lot of tests, so there was this issue of multiple comparisons. They probably should have adjusted their p-value threshold there from 0.05 to maybe use a Bonferroni adjustment and divide by the number of tests that they did. But another problem is they just reported on that green jelly bean link in the news. So the solution here is to just describe all analyses that were run, even if the results were not significant, and this just allows the reader to kind of judge the importance of the findings in the context of all of the tests that were run. Okay, so finally we have irreproducible research. So irreproducible research is not providing the details needed to recreate the analyses that were run. And this is probably more the job of the statistician, although how the variables are coded is helpful to explain as well. But there's often a few different statistical methods that could be run, and the details of these methods should be included either in the methods section of the main manuscript or potentially in an appendix, if that's possible. And the idea is that you want to include enough details so that the analysis could be recreated if the data were made available to a third party. In summary, the first thing that you should do is focus your research question. You should try to conduct hypothesis-driven research using a statistical analysis plan and a literature review to refine your research questions. Performing a sample size or power calculation before the start of the study is also helpful, and don't conduct an underpowered study. Finally, you should describe all analyses that were done and provide enough details that the analysis can be reproduced. I mentioned that a few articles have been published fairly recently, and this is the list. A good place to start is the Ioannidis article that kind of kicked it all off with why most published research findings are false. The SDBC website also has some guidance on good research practices, and you might also check out my next talk, The Value of the Statistical Analysis Plan for Medical and Scientific Research. Thank you.